I'll never forget the time I put my finger through a hole in a patient's chest and felt their heart beating. I wasn't in surgery, I was standing in the middle of a busy emergency department. And it wasn't so much the heartbeat against my finger that made it unforgettable, it was what happened afterwards. My patient was a lady who'd fallen from a ladder. She'd landed awkwardly on some plant pots and had broken several ribs. One of them had cut a blood vessel and she was bleeding into her chest cavity. The blood was accumulating and squashing her lung. Her vital signs were stable, so I had some time to sedate her properly, manage her pain control, and explain the procedure. She wanted her husband to stay, so he did. The treatment for this condition is to insert a tube into the chest cavity, drain the blood, and allow the lung to re-expand. But it's easier said than done. You're working with quite a narrow window between vital structures, and this was in the days before ultrasound became standard, so you're kind of going in blind, putting your trust in the anatomy. Anyway, I'd done it several times before. I felt okay about it. I made an incision, started working through the layers of muscle, blunt dissecting with a long clamp. I did that until I hit the pleura, that's the inner lining of the chest cavity, just between the ribs. You got to put a bit of force in and punch through it. When I did, there was a gush of blood and this kind of horrible squelchy sound where the air mixes with blood and bubbles out. It's kind of disgusting, but it always happens that way. Then I put my finger in, which is what you do to check there's nothing debris in the way that's going to impede your tube when you insert it. And that's when I felt the heartbeat. It was quite amazing, but I didn't have any time to appreciate it because there was movement to my side and then a thump. The lady's husband had walked around the bed, had seen what I was doing and promptly fainted. I froze because I was in the middle of a sterile procedure and you can't just stop to do something else. Someone pulled the emergency bell, someone else knelt over the man about to do CPR. Thankfully at that point the sister shouted, and I remember her words. She said, "Stop it, you tit, he's fainted. Lift his legs." They did. He woke up, he was okay. I inserted the drain, sewed the patient up, and everything was fine. We often focus on the patient, keep the patient calm, keep them sedated, help their pain. Sometimes we forget about the relative.